Yes?
Hello, my name is Althea and I'll be your student nurse today from Kaiser University. I will be performing a physical assessment of you. I have performed hand hygiene and donned my PPE gloves. I have provided patient privacy. I'll close the door. Okay, and before I proceed, can you tell me your name and date of birth?
Roger Plummer.
Okay.
November 6th, 1982.
Okay, thank you. And would you like for me to call you Mr. Plummer or Roger?
Roger's fine.
Roger's fine. Okay, Roger. Do you have any pain at this time?
No pain.
No pain. Do you have any allergies to latex medication or food?
No allergies.
No allergies. Do you use any assistive devices or are you able to ambulate independently?
I believe independently.
Okay, excellent. Do you wear any contact lenses, glasses, or need any assist for vision?
No, nothing.
Okay, perfect. So I'll go ahead and raise the bed up to a good working height for my body mechanism and put the rail down for patient safety. Okay, I have assessed pain. Patient is in no pain. I have also assessed the patient's overall body posture is erect. The patient looks well groomed. Patient is also properly dressed for the season. The patient has no foul smelling odor detected. The patient's body weight and height are within normal limits and are proportioned evenly for the patient. Okay? And I will now assess the patient's level of consciousness. Roger, could you tell me where you are?
I'm at home right now.
Okay. And can you tell me what year it is?
This is 2020.
Okay. Who is the President of the United States?
Donald Trump.
Okay. And what day is it?
Today is Monday.
Monday. Excellent. So the patient is alert and oriented ×4, as evidenced by him answering the questions. Do you need any assistance with communication, such as hearing aids or sign language? Do you have any difficulty communicating?
No.
Do you understand how I'm communicating with you?
Yes.
Excellent. Okay. So I will now go ahead and begin your physical assessment, and this will begin from your head and I'll work my way down to your lower extremities. Okay? Okay, so I will assess the hair. Okay, the patient's head is normal, round, normal cephalic and round. Hair I have assessed on the patient's head is full. There are no lesions. There are no bumps or lumps felt on palpation. There are no signs of infestation on the hair, on the head. There are no signs of baldness or alopecia. The patient also has facial hair, and I will assess that. Okay. Okay, I have assessed the patient's hair on the face is full, no baldness or redness detected, no infestation. Patient mouth is symmetric, face is symmetric. Patient's skin appears to be normal. It's warm to the touch. Okay, capillary refill lasts less than 3 seconds. There are no clubbing detected. No abnormalities. Okay, the patient has no hair on the skin, no scars, no redness, no rash detected on the patient's skin. Okay, I'm assessing the patient's skin turgor. Okay, and skin turgor is normal elasticity, no edema, no swelling noted. Okay, patient's eyebrows are also normal, symmetric bilaterally. I'll check the hair. No infestation or balding noted. Okay, Mr. Roger, I'm going to go ahead and assess your vision. Okay, I do have a chart. Okay, this is called the Rosenbaum chart, and this is held about 12 inches from your nose, and I would like for you to tell me if you are able to read any of these lines. So go ahead and cover your left eye. Can you see this line?
Yes.
Can you read what this line says?
Yes.
And this line?
Yes.
And this line? Excellent. Go ahead and cover your right eye. Do the same thing.
Do I just read?
Are you able to
Yes.
read that?
Yes.
And that?
Mm-hmm.
Okay, excellent. So with the Rosenbaum chart, patient is able to see vision 20/20. Okay. I do have a Snellen chart on the board, and I would like for you to go ahead and do the same thing. It's similar, it's just farther apart. Cover your left eye. Are you able to see this line?
Yes.
This line?
Yes.
This line?
Yes.
Okay, cover your right eye. How about this line?
Yes.
This line?
Yes.
This line?
Yes.
Excellent. Okay, I have assessed with the patient's vision. Patient is seeing 20/20 unaided. Okay, now I will be using my pen light to shine into your eyes to check your vision. Okay, I'm going to lower the light. Okay. Okay, look straight ahead for me, Roger. Okay, excellent. Okay, and look at the pen, and I want you to go ahead and follow my pen light. Are you getting dizzy,
Yes.
Roger? I'm sorry, I may have moved it too fast. However, I have assessed Perla. The pupils are equally round. They react to light and are accommodating. Also, I have assessed the patient's cranial nerve number 2, optic nerve, is intact. I've also assessed cranial nerve number 3, ocular motor, is intact. And I'm going to go ahead and assess your nose. Okay, I will palpate for any lumps, no bumps, lumps felt. Are there any tenderness?
No.
Okay. All right, and I'm going to shine the light in your nares to check as well. Put your head back for me. Okay. Nostrils are clear, pink, moist, no obstruction noted. And you hold one side and blow for me. Same on the other side. Okay, airway is clear. Now, Roger, I'm going to be touching and pulling on your eyelids. Okay, on the eyelids, I've noted no drooping on upper and lower eyelids. Eyelashes are also symmetrical bilaterally. There are no infestations noted. Eyelashes are full. Okay. Okay, conjunctiva is pink and moist, and the sclera is white. Okay, so your vision, patient's vision is intact. All right, I will assess your oral mucosa. Okay, so top and bottom lips, mouth is symmetric. Okay, chin is also symmetric. If you can open your mouth for me. Okay, lift your tongue. Okay, it's pink and moist. No dental caries noted. Okay. Where's my fork? All right, and I will be assessing your gag reflex also. Okay, open for me. Okay, tonsils, pink, moist. Epiglottis is normal hanging.
Okay.
Okay, I have
Don't forget to test.
I have assessed the patient's vagus nerves, and it is intact as evidenced by his gag reflex. Okay, and can you stick your tongue and move it side to side for me? Okay, cranial nerve number 9, the hypoglossal nerve is intact. Okay, and can you swallow like you're taking a drink of water? Just swallow. Okay, excellent. Cranial nerve number 12, glossopharyngeal is intact as the patient demonstrated by swallowing. Could you bite down? Okay, excellent. All right, now I'm going to go ahead and assess your facial nerves. Cranial nerve number 7, facial nerve, and I will be doing a test where you tell me if you feel sharp or soft. Okay, close your eyes. Okay. Do you
Sharp.
feel okay?
Soft.
Okay.
Soft. Sharp.
Okay.
Sharp. Soft.
Okay, you can open your eyes. Facial nerve, cranial nerve number 7, facial nerve is intact. Okay? And I'm going to go ahead and assess now your ears. Okay? I'm going to pull the frenulum, the pinna. Whew, what's that? Okay, I have palpated the ears. No lumps or bumps felt. Okay, I'm checking the back for any break in skin integrity. Okay, no drainage noted. Okay, ears are symmetrical bilaterally. Okay, I'll also be using my otoscope to check the inner ear. Okay, and that is silver and shiny. Inside the ear is clean and clear. No drainage detected. Okay. Okay, I'm going to be covering your ear and whispering, and tell me if you hear the word that I said, okay?
Yes.
Okay, did you hear what I said?
Yes.
Okay, I'll be doing the same thing on the other ear.
Yes.
Okay. So I have observed that the cranial nerve trochlear is intact. Okay, and I'm going to check the sinuses. Okay. Not palpable. And also, I'll be assessing the temporal pulse. Okay, bilaterally they're 3+ and regular. Okay, I'll assess the patient's lymph node, submandibular, auricular, temporal, okay. Patient's lymph nodes are not palpable and no abnormalities felt. Okay, I'll also assess your carotid pulse. Okay. Okay, carotid pulse felt on both sides bilaterally. 3+ bounding. Now I'll be assessing these. Listen to the carotid pulse with my bell. Okay, regular sounds heard on the carotid pulse, no bruit detected. Okay, can you turn your head to the left? I'm going to be pushing against. Okay, good. To the other side, turn. Okay, and I'm going to be checking your accessory muscle. Can you go ahead and shrug your shoulders for me? Okay, excellent. Accessory muscle is intact. Okay, can you hold my hand? Squeeze. Ooh, 5+ strong muscle strength. Excellent. Okay, now I'm going to assess your lung functions. Okay, and I've also assessed that there are no lumps, bumps, felt. Okay. I'm going to put your feet down, sit forward for me. Breathe in. Breathe in. Breathe in. Breathe in. Okay. Breathe in. Breathe in. Breathe in. Breathe in. Breathe in. Okay, I've auscultated the lungs and regular resonance heard over lung sounds, no hyper-resonance or hypo-resonance detected. I will be assessing the frenum. If you could sit forward with your feet flat on the ground, or if you could stand. Okay, turn this way. Okay, and I want you to go ahead and repeat 99.
99.
99.
99. 99.
Okay, excellent, frenum noted. And I'll now be checking your inspiration and expiration. If you could go ahead and inhale for me and exhale. Okay, inhale and exhale. Okay, turn around, you can sit. Okay, posteriorly and anteriorly, the patient's lungs are symmetrical on inhalation and expiration. Bilaterally, they're even. The patient is breathing normally on room air, no labored breathing noted. Patient's chest rises and falls equally bilaterally. And I have already assessed the patient's vital signs, and those have been documented. So patient's saturations are within normal limits. Okay, and can you tell me the 4 words? Can you recall from me the 4 words?
Mm-hmm.
Okay.
Boy, girl, mom, dad.
Excellent. Okay, so the patient's short-term memory is intact. Excellent. Okay, now I need to assess your cardiac functions. Okay, and I'll be listening to the cardiac sounds. Let's put this in the wrong way. Okay, patient's cardiac rhythm is normal as S1 and S2 sounds were heard clearly over the diaphragm, the auscultated patient. And I'm gonna go ahead and check your radial pulse. Okay, and your brachial pulse. Okay, excellent. So patient's brachial and radial pulse are 3+ bilaterally. No abnormalities felt. Okay, so I will need you to lay back. Okay. All right, I have inspected the abdominal quadrant and noted that there are no abnormalities, evenly distributed. There is no signs of abnormal symmetry. Okay, and I will first be auscultating and listening to the abdominal quadrants, beginning with the right lower quadrant, moving to the right upper, then over to the left upper, down to the left lower. Okay, and normal active bowel sounds are heard in all 4 quadrants. I will also be listening to the aortic valve in the patient's abdominal cavity area. Which is found just at below the 5th intercostal space, mid-clavicular below, and no bruit detected. I will also assess the patient's apical pulse for 1 full minute. Okay, patient's apical pulse assessed for 1 full minute is a 70, which is normal. Okay, now I will percuss, beginning at the right lower, using 1 finger. Okay, I have percussed all 4 quadrants of the abdomen, and no abnormal sounds detected. I will now go ahead and palpate the abdominal area. Do you feel any pain, tenderness?
No.
Okay, no pain or tenderness felt in the abdominal area. And that completes the assessment of the abdominal area. Okay, you go ahead and sit up for me, Roger. Okay, I have assessed the patient's femoral artery, which is located on the inner groin. I've assessed both pulses are felt in 3+ bilaterally. Okay, and I'm going to assess the popliteal. Bend your knees up. Okay. The dorsalis pedialis. And the posterior tibialis. So I have assessed all the pulse on the lower extremities. They are bilaterally 3+, normal, no abnormalities detected on the pulse. And also I have observed that the skin is intact, no swelling on the lower extremities, no clubbing on the toes. Okay, capillary refill are 3+, less than 3 seconds. Capillary refill. Okay, now I'm gonna check the patient's balance. Now, if you could stand for me. Okay, and if you could just take 4 steps just in front of you in a straight line. Okay, and back. Okay, lift your arms out. Okay, to the side. Move them around. Excellent. Okay, touch my finger. Okay, the other hand. Okay, touch your nose. Okay, bend over, touch your toes. Okay. The patient's upper and lower extremities are functioning normal, as evidenced by the patient being able to ambulate, have normal balance, and being able to bend, touch his toes, his nose. Are you feeling okay?
Yes.
Okay. Can you recall those 4 words for me?
Yes.
Okay.
Boy, girl, mom, dad.
Okay, excellent. I have observed the patient's long-term memory is intact. Okay, you could go ahead and sit for me. Thank you. Okay, and I need to also assess your hearing, okay, using the RIN. Now, what this will check is your bone conduction. It will measure your bone conduction against your air conduction, and this will help to determine if there's any hearing loss. Okay, so I will have the RIN to vibrate. I'm going to put it first on the top of your head. You should feel it vibrating. Do you feel it? Okay, tell me when it stops.
Stop.
Okay, I'm going to do it again, and I'll be placing it on the back of your ear. You hear it? Tell me when it stops.
Stop.
Okay, now I'm placing it in your ear. Do you hear that? Do you hear that?
Yes.
Okay, I'll be doing the same thing for the opposite ear. Bone conduction. Do you hear that? Does it stop?
Stop.
Okay, and do you hear that?
Yes.
Excellent. So the patient's air conduction is greater than the bone conduction, and that means that there is no evidence or sign of hearing loss. Okay, and are you feeling okay?
Yes.
Do you have any questions?
No.
Any concerns?
Mm-hmm.
Would you like a drink of water?
No.
Okay, so that completes our physical assessment today. And thank you for being a great sport.
Thank you.
And you have a good day.
Stop it.